Evening and welcome once again. Today is our 1407th day of uninterrupted webinar. And today's our guest is Srikant Talari. He's practicing for 15 years. He started his charitable OPD in Lonavala. And he's presently working for a cancer care clinic at Prana. Prana is the first homeopathic yoga center with world-class infrastructure. And he's author of Art and Skill of Case Taking. And he's taking classes and conducting seminar in national and international levels. He has been taken online lectures for Western College of Homeopathy in Canada. And he's active part in researches. He had done research in during COVID time and now presently doing research in granulomatous mastitis. And today he's going to take BORGES approach to homeopathy. Dr. Srikant, okay, doctor joined. Okay, I made you as a co-host, doctor. Please, you can start. You are welcome.
Thank you, madam. So hello everyone. I was under the impression that my topic is actually mind rubrics, but that's okay. We will talk about bogus synoptic key. Okay, so bogus approach. Yes. So when we think of bogus approach, I think what is very important to understand is that Boger obviously believed in Bonninghausen's complete symptom. His work starts from Bonninghausen's complete symptom, and therefore Boger gives a lot of importance to modalities, concomitants, sensations, location, various aspects of complete symptom. But I think the main addition that Boger did to Bonninghausen's work is he added the clinical knowledge. And based on this clinical knowledge, he started developing a general understanding of the pattern of disease in the patient. So, for example, I want to share with you cases through which I learned what actually Boger's approach is. And this are two such cases. So case number 1. This is the first case when I realized the importance of Boger's approach and what it actually means. So this is a case of a 9-year-old boy who came to me with complaints of nose block and hypertrophied nasal turbinates. So what happened is he also had the complaint of itching in anus. Okay. So what happened? I was treating this patient, and I think one symptom that the mother told me was that my son, what happens occasionally is when he goes to the sort of washroom or when he goes to the school, sometimes what happens is he passes stools involuntarily. He will suddenly say
Doctor,
that
there is a request from to make it big. I mean,
the
maximum.
font size.
Yeah, not the font size.
Huh,
Uh, your screen now it is
okay, just a minute.
enlarged. Screen.
Okay, I will share my whole screen. Is
Yeah.
this better?
No, now as okay. Then it's visible only. She requested in the chat box, so I mentioned. It's okay. It's okay. Then you
Okay.
can.
Involuntary. So mother says that the child passes stools involuntarily occasionally. And at that time, he complains of itching, scratching, and things like that. Okay. So, based on this, I think all of you know what remedy comes to our mind. Anybody? If you can type in the chat, what remedy comes to your mind? Yes. Anybody in the chat? Any answer? No? Okay. So the remedy that I actually started with was, okay, somebody has Retania. Okay, actually, the remedy I started with was aloes. Aloes is known for involuntary stools, cannot control stools, symptoms like that. So I started with aloes. And what happened is that the patient, mother said maybe he's better. Okay, but his nose complaints were more or less the same. Okay, now I thought, okay, patient is better. So 2 months passed. After 2 months, the mother comes and she says again the same thing has happened. So I thought it's a relapse of complaint. For 2 months he didn't have any symptoms, so I think I should give the same remedy. I gave the same remedy again for a month. Patient was better, but this time after 15 days it relapsed again. So then I started getting doubt that why is it repeat relapsing so often? No, I give aloes, patient gets better. Within few days, again he starts having complaints. So doubt started to creep in. Maybe aloes is not the remedy. Then what happened is that one day the mother called me up and he said that, doctor, yesterday night was the worst. I said, why? What happened? No, the whole night he was just sitting. Sort of, he was not sort of able to sleep. And along with this, I had to also stay awake the whole night. So that is when, I thought this is too much intense suffering. So then I realized that I need to change the remedy. So what I did is I went to Fatak's Materia Medica. If you open Fatak, and if you open anus, and there if you go into itching, if you see here, there is one rubric which says anus, itching, sleep preventing. There is a single remedy there, which is what? Teucrium marum varum. Okay. Now, what is interesting is now if you open Fatak's Teucrium marum varum from Fatak, you see here it is written nasal and rectal complaints. You remember the patient's other complaint was what? Nose, no? He had hypertrophied nose, blocking of nose, all those complaints. So what happened? I gave the patient the remedy Teucrium marum varum, and I gave him Teucrium marum varum 200, and with 200 he improved. I gave him Teucrium. I gave him Teucrium 200. I gave it repeatedly, and he started to improve. So then, he never complained. After I gave Teucrium, he never complained of this itching. That never happened again. So I thought this is very nice. But then, I thought, now what will happen to the nose? And then slowly the nose started improving. As the nose started improving, I said, how did this improve? And that's when I read the Materia Medica, and then I found that this remedy has nasal and rectal complaints. So I was like, pretty happy that good, things have improved. But that is when a question started to come to my mind. Why did this improve? There is no sort of direct connection between what? Between the nose and the anus. How did Teucrium marum varum work on both levels? So I wanted to know. I was very interested. Why this happened? Why this happened? Generally, I know we feel that, if you hit the keynote, all symptoms of the patient improve, so maybe patient improve. But I wanted to know the reason behind why did this patient improve. So what I started to do is I started to study each complaint, and I started to understand what is behind, why there is itching, why there is itching in anus, why would the patient have involuntary stools, etc. And when I started firstly with the rectal complaints, and when I read this, that what does this mean? Patient has itching in anus with involuntary stools which appear intermittently. Then I came to know that this is common in children, especially when they have worm infestation. Okay, so I said, okay, it's worm infestation, no problem. But then how did if I gave Teucrium marum varum, maybe the worms fell down. But why does the patient develop nasal complaints then? Okay. Then what I understood, this is very interesting, that in all worm infestation patients, you will also have high eosinophil count. Right? You'll have high eosinophil count. So the patient will have lot of allergic conditions. Yeah. Patient will have lot of allergy conditions, and patient will therefore have a tendency of developing recurrent sneezing, recurrent cold, recurrent coryza. And when this recurrent thing becomes a constant thing, then it converts into a chronic disease. And that is why the patient has chronic hypertrophy nasal complaints. And that is when I understood that actually there is a thing that explains why you have two different apparently disconnected symptoms getting connected. And that getting connected happens when you understand the clinical aspects. How I understood the connection between rectal complaints and nasal complaints, because I understood that primarily this remedy has worm infestation, and because of worms it has nasal and rectal complaints. And now if you read Materia Medica, you will see here it is written, see, thread worms. It is especially useful in thread worms. Okay, now our topic is Boger. Now let's see what Boger says. Oversensitive, excitable, crawling nose. Here he has not given a clinical condition, but this is what is Boger's approach. But with the next case, it will become more clear. But why I used Fatak is extension of Boger's synoptic key. Sometimes when you don't find the clinical understanding given by Boger, it is a good way to look what Fatak has written about this remedy, because both have very good clinical basis, and they will tell you what is the connection between the different symptoms. Okay, did you all understand this case, that how two different apparently disconnected symptoms find a connection during the study of a clinical condition? Are you all with me? Hello, hello. Can you please give me feedback? You can type in the chat. Yes, no. Hello. No. Okay, someone has typed. Okay, thank you. So now this is what you have to understand. If you want to understand Boger, you have to understand that he has a clinical background. Okay. So with the second case, I hope things will be even more clear. So case number 2. Again here, patient comes with two presenting complaints. The first presenting complaint is patient says, I have difficult swallowing. I have difficult swallowing. So, and the second complaint is patient says, I am allergic. I am allergic to eggs. Right? So now what happens is, I ask the first complaint, tell me what can you tell about this difficult swallowing? So he tells me that what happened, doctor, around 6 months back, my wife gave me a fruit. इधर in Maharashtra we call it boar, ऐसा बड़ा बेर रहता है. So I was eating that, and I don't know what happened. Just while I was eating that, suddenly I felt like an obstruction in my throat. Over here, I felt it got stuck or something. And then I had this stuck feeling, and all this started since that time. I had this stuck feeling, but it stayed for a day and then it disappeared. Then I felt normal for some days. But what happened after 1 month, I again had this same stuck feeling in the throat. I felt like something is stuck here and I'm not able to swallow. And then slowly I realized that things are getting stuck. So I started taking treatment, etc. But everybody said there is nothing there that we can see, no problem. And as it is, this stuck feeling comes, stays for a day, and then it completely disappears. For 1 month, I will have no complaint. But again, after 1 month, it would come, it will stay for 2 days, and then it will disappear. Now what has happened is its frequency has increased. Now I am getting it almost every 15 days. Firstly, it was when it started, actually, it was once in 2 months. Then it became 1 month. Now it has become every 15 days. So every 15 days, I will feel that there is some stuck feeling here in the throat. After some time, the stuck feeling is gone. So what do you feel here? I feel like, some tightness kind of sensation, and then it disappears. So now this is the first complaint. Okay, I don't see any other modalities, concomitants, etc. So I ask him, okay, now let's talk about your allergies. Okay. So then I said, what is this allergy to eggs? So he says, doctor, I can recognize if you tell me that this cake does not have egg, and I will eat it. If I develop complaints, I know that I have what? Stuck feeling in the sorry, I will have pain in abdomen if I don't eat. I was disturbed by the phone call. So he says that if I eat a cake which has egg, or if I eat egg in any form, then what will happen is immediately I will develop pain in abdomen. I will develop pain in abdomen. And this pain in abdomen will be so severe that I will feel like whatever I have eaten has got stuck there in the what you say, in my intestine. In my intestine, I feel like they have got stuck there. The food is not moving forward. It's got stuck there. And And I think it stays for around 2 hours. This pain stays for around 2 hours and then it disappears. Then the complaints are gone. But when it pains very severe. And I feel like putting something very hard and pressing it hard and bending double. If I press it hard and if I bend double, then I will feel better. Get it? Hard, pressure, or bending double. Okay. So now, can anyone tell me, huh? Do you see any connection between these two complaints? Is there a connection? Can you see a common pattern in these two complaints? These are two apparently different complaints. One is difficult swallowing, other is allergy to eggs. These are two different complaints. But can any one of you suggest what is common in both of them? Yes, anyone? Can you please type in the chat? Time, very good, Dr. Dhanesh. Can you please explain? Constriction, very good, Dr. Afzal. Anyone else? Can you please? Stuck feeling is also common. Yes. What else is common? Anybody? Okay, so now let me explain. Okay, so first let me start with the eggs complaint. Okay, movement is less. Okay, so let me start with the egg allergy. So firstly, what you see, patient says I am allergic to egg in any form. Okay, now tell me, if there is allergy to a particular thing, what is the most common symptoms we will see? We will see symptoms like I have rash on my skin, I have itching, I have redness, I am swollen. Yes or no? No? These are the expected symptoms of allergy, that you will have rash, you will have itching, you will have urticarial rash, or you will develop sneezing. These are generally symptoms that we associate with a allergy. But what is interesting in this case is he says I am allergic to egg, but he seems to develop complaints in the abdomen. He is not developing a allergic manifestation on the skin. He is not developing it in the respiratory tract. He seems to develop in the GI tract. This itself is, slightly uncommon characteristic, that he seems to be having an affinity towards the GI tract rather than the skin or the what respiratory tract. Okay, now what is interesting again here is that in this complaint comes for some time, it stays for 2 hours, and then it goes away. And you see, it's the same pattern in the difficult swallowing, that something comes for some time, stays for a day, and then it disappears. Yes or no? The pace is common. Something comes, something goes. So it comes periodically. So it is intermittent. Are you getting this? It is intermittent. Something comes, goes, comes, goes, comes, goes. So the pace is common. The pace of disease is common. Also, in the first complaint and in the second complaint, what is common is GI tract. No, in the first complaint also, what is getting affected? The esophagus. I have difficulty in swallowing. Here again, the location is GI tract. In allergy also, location is GI tract. Are you with me? Now another thing that is common is in both these, the sensation also is common, which is what? The sensation also is common, which is what? Stuck feeling. No, it is stuck in the throat, it is stuck, food is stuck in the intestine. So it is stuck feeling, or you can say constriction, stuck, different words for the same feeling. So now the Boger's approach is first you find the common pattern between two different complaints. Once you find the common pattern between two different complaints, now you start thinking, what kind of clinical condition is this which will explain GI affection, which creates a kind of constriction sensation, stuck sensation, and then it completely disappears. ऐसा क्या होता होगा इधर और पेट में जिसकी वजह से पेशेंट को ऐसे सिम्टम्स आ रहे हैं? What could be happening? Can anyone guess what kind of clinical condition could be happening? Very nice, Tessie Sebastian. She says spasm. What is happening is spasm. Spasm. That's why sudden. You know, मैंने बोर खाया. I ate boar and immediately it caught. So complaints come suddenly and they cause constriction, cramped feeling, or a spasm there in the throat. After some time, spasm releases, patient feels no complaint. Same thing in egg allergy. I eat egg, the intestine contracts. I feel all food is getting stuck. After some time, the contraction release, food passes, everything is normal. So now you understand why the pace of disease is like that. Now you understand how GI affection with spasm. Yes or no? Everyone? Hello? Can you please reply?
Yes, sir. All are muted. That's why.
Okay. Thank you. So then when you open, now if you go to MacFOS, so the remedy this patient received was actually magnesium phos. And all of you know why magnesium phos, because you know the modalities of magnesium phos, no? Which is what? ml rated by hard pressure. And second remedy that will come close is Colocin. Now, if you open Boger's synoptic key, magnesium phos, Boger's synoptic key, and you see here sudden spasms of pain. And you see here colics and cramps. This is the common pattern. See, suddenness of complaint. Suddenly I was eating boar and suddenly it developed, and since then it has stayed on. So complaints will come suddenly in the form of cramps, colics. That is why it's a good remedy for colics, because it will cause spasms in the stomach, abdomen. But it can cause spasms everywhere. It can cause spasms in the hands. That's why it is also a good remedy for piano players. No, if you read Allen's keynote, piano players, you see, they will play, and then the muscles cramps develop. So cramps, convulsions, cramps, colics. This is what is common general pattern of magnesium phos, and this will happen irrespective of location. It will happen well in the arms, it will happen in the GI tract, it will happen in the menstrual during menses, in the uterus, it will happen in the calf muscles, it will happen anywhere. So location is not specific, but the pattern of cramps is specific. This pattern is known as the pathological general. This is what Boger's approach is, to find the pathological general pattern that covers different apparently disconnected symptoms. That if you try to understand what is the underlying pattern between these two apparently disconnected symptoms, that is what Boger's approach is. And specifically during this, the knowledge of clinical understanding becomes very, very, very important. Get it, everyone? Am I clear till now?
Yes, sir.
So that this patient got magnesium phos, and with which she did well. Once you find the pattern, then you know already these modalities are of magnesium phos. Okay. So should we do one more case? Case number 3. So case number 3. This is a case of a man who came to me, of a 35, 40-year-old male patient who came to me with complaints of he had multiple complaints. He had pus boils on knee joints. He had pus boils on knee joint. Then he had feverish feeling, weakness. Okay. Then he had constipation. Then he had indigestion issues. He said, I do not feel hungry. My stomach always seems full. And suddenly I will feel hungry. And I'll feel so hungry, like my abdomen has become empty. There is emptiness in my stomach. And I will have pain in my legs. And all this will get better if I eat something at that time. Get this, everyone? So now, one approach is, you know what? Actually, what you can simply do is, this seems very characteristic. No pain in legs or body pain, fever, better by eating. Yes or no? Pain in legs, better by eating. Is it common? Is it expected? No. So initially I thought maybe this is characteristic. So I went to you to the repertory and I said complete repertory. And you go to extremities, pain, eating, ameliorates. So nice rubric, no? Thallium metallicum, phagopyrum, guaiaco, and nitrum carb. So what I did, I asked some leading question. How are you? How are you with sun, etc. He said, I cannot tolerate heat of sun. I am aggravated by sun. I said, very nice. So I thought nitrum carb is good remedy. Yes or no? Does it seem good? Heat aggravates, weakness, sun aggravates. So I thought nitrum carb is good. So I told take nitrum carb, but patient was not better. Okay. So now my problem is I felt I found a keynote characteristic symptom. I prescribed on that. I also asked for some confirmatory questions of nitrum carb. Still, it did not work. So what to do now? One way is you can start prescribing one remedy for each complaint. You have pus boils, okay, take Hipar-sulf, Calcarea-sulf, etc. You have feverish feeling, take belladonna. You have constipation, I'll give you something for constipation, so on and so forth. But the more effective and the more real approach is to find one remedy which matches all the symptoms. You know, we saw two cases. There is always one remedy that matches all the symptoms. And you have to find what is that one thing that matches all the symptoms. till now, whatever we saw, it was only 2 complaints patient was having. So it was easier. Yes or no? But now this patient has so many complaints: pus boil also, fever also, constipation also, indigestion also. Which symptom should I pick? And I was thinking, if I keep doing complete symptom of every single, when did the pus boil start, what is the sensation in the pus boil, what are modalities of pus boil, etc., etc., then it will take me 1 hour to take the case. Maybe more than that for each symptom if I try to form complete symptom. So then what I decided, instead of doing all this, what I decided, this is very important, and this is where I learned a lot, and this is the most important thing that I want to tell all of you today, that when you have multiple complaints and when you don't know where to begin and which is most important out of this, you should ask the patient, tell me, when uh, since when you started falling ill. Since when you started falling ill, tell me. So patient said, I started falling ill 3 months back. Okay, 3 months back. So what happened 3 months back? Why did you fall ill? He says that I don't know why I fell ill, but I have fallen ill since that time. So then I asked him, what was the first complaint? What is the first thing that you developed? Now you have so many complaints, but what was the first symptom that you developed? So he says, all this started with constipation. I said, very good. So let's start from there. Let's start from constipation. Talk about your constipation. So he says, I don't know, doctor. I have this. It all started with this weakness. I said, what weakness? He said, I used to get up in the morning. I used to feel that I want to go to the washroom. But if I go to the washroom, no, I felt like, my muscles, they don't have strength. And I'm not able to uh, I'm not able to um, pass the stool. I feel I'm trying to strain, but stool is not coming out. I don't know why. I'm trying to strain, but I feel I'm not able to. The muscle, no, it's not contracting. It's just there. So then I used to feel that, stomach is not getting empty. So I used to feel this fullness. Full day, I used to feel my stomach is not clear. I'm feeling full. I'm feeling full. So that's why I used to not eat anything. कुछ खाता ही नहीं था मैं, full. Then if I don't eat, then I started feeling very weak. Sometimes I feel so weak that I feel that everything has got empty, and immediately I have to eat something, and then I will eat something, and then I'll feel better. Okay. Now, can you understand that there is a connection between all these symptoms? No, constipation, indigestion, emptiness, etc. Yes or no? That these are all evolution of this main primary complaint, that is constipation. So then I understand that if I treat the constipation, all these symptoms will improve. Correct? So I started focusing on constipation. And what was characteristic there was that I am straining, but the stool is not coming out. I feel like I am straining, but the muscles are not moving. Anybody knows which remedy this is? Yeah, anyone? Okay. Arey wow, very good. Sebastian. What is the symptom? Why you chose gelsemium? Yeah, Sebastian, can you please tell us the symptom? Why did you say gelsemium? Okay, so let me now open. So if you open gelsemium, no, one of the most important symptom of gelsemium is, yeah, gelsemium is, it is not actually muscle weakness, it is paralysis. Paralysis, trembling. The most important symptom of gelsemium is, you see this, motor paralysis. Motor paralysis. Even if you open Boger, you will see. Aching, tired, heavy. There's no paralysis written. Over aching, heaviness, tremor of single muscles. You see this? Paralytic effects. Paralytic effects. Paralysis. So this is what you have to understand. The actual symptom that the patient narrated is this, which in Materia Medica it is written, like muscles do not obey the will. Where is it written? Muscle. Complete relaxation, prostration, lack of muscle coordination. This is what the patient is saying that I am trying to strain, but the muscle do not coordinate with me. I am trying to push, but the muscles do not coordinate with me. I am not able to push my muscles. इधर कहीं पे लिखा है क्या? Muscles do not obey the will. Okay, it must be written in some other Materia Medica. But that is the keynote symptom of gelsemium. Maybe it's written in Allen's keynote. Complete relaxation. See again here, complete relaxation, prostration of whole muscular system, and entire motor paralysis. Extreme irritability, anxiety, depression, weakness, and trembling. So this is another thing. So in gelsemium, what happens? One is paralysis or other is trembling. Paralysis is I want to move, but it does not move. Trembling is I don't want to move. I don't want my hand to tremble. I'm trying to stop it, but it does not stop. It keeps trembling. So doctor gives something. This trembling should stop. Why am I trembling? I am not able to control this trembling. So that is what is incoordination. When I wanted my muscle to move, it did not move. When I don't want it to move, it is moving involuntarily. Stop it, stop it, stop it. So that is what is lack of muscle coordination. That is what happens to this patient. And then if you read the stomach section, no, you will get the exact description in Boric of what this patient talked. Okay. Gelsemium, sensation of emptiness and weakness in the pit of stomach. Huh? See, stool, paralytic, partial paralysis of rectum and a sphincter. So that's what happens in, see, and this will be seen everywhere. See, again in urine also paralysis, rectum also paralysis. Any organ you go, you will see paralysis. Let's see eyes. Eyes also it will be given paralysis. Then ptosis. See, first sentence itself, ptosis. Ptosis means what? Nerve is not working. The muscle has lost its strength. See, orbital neuralgia. So this is what is Boger's approach, to understand the underlying pattern that will tell you what is the underlying clinical disease that is happening, which is giving rise to all these symptoms. The most important thing about Boger is try and understand what is behind all these symptoms and not just get lost in the plethora of symptoms. If you get lost in the plethora of these symptoms and if you start repertorizing all these symptoms, feverish feeling, weakness, constipation, aggravated by this, ameliorated by eating, etc., you will feel like you are doing Boning Hussein's complete symptom, but it is too scattered. There is no actual spirit of what the patient is really suffering. Boger's approach is to find the spirit behind all these symptoms. What is it behind all these symptoms which is giving rise to all these symptoms? That if you are starting to look, and if you are starting to look at what is behind with clinical understanding, that exactly is what Boger is trying to teach us. That is Boger's approach. And that is why he says always look for the pathological general. This is the general pattern. This is what is known as pathological general. This is the general pattern behind the multiple symptoms. Yes, everyone, did you get it? So, should we do another case? Or you want to ask any questions?
Actually, we have 15 minutes. I
Okay.
mean 14 minutes.
Hmm.
But I think if we started with the case means that will take 10 minutes, right?
Yeah.
Participants, please say what is your opinion. Shall we continue with the case or you need time to ask question? 2-3 comments, please. Case, huh? Okay, thank you. Please type in the chat box. I got only one response. Please. What you need? Okay, case. So we'll continue with the case. That will be nice.
Case number 4. Okay. So case number 4. Okay. So in the last case, what we learned is the importance to first symptom when you find difficulty to understand the actual pattern behind. If you focus on the first symptom, you will know what exactly is getting affected. Okay. So like that, one more case that I want to share with you is a case of a, let me just think, case of a, yeah, it's skipped my mind. Okay, so this is a case, case of a female patient. She came with complaints of fever. She came with complaints of fever, um, which is almost daily since the last, 1 month. Daily she has fever, every single day. So why you developed this fever? I developed this fever because I had undergone an knee replacement surgery. So I underwent a knee replacement surgery, and after that surgery, what happened is that I had severe swelling, redness, heat, congestion in that left knee joint. Very severe congestion. I could see it was very red, swollen, and she had lots of pain. And she said, I since that operation, no, I have developed this fever, and this knee has not healed. When I had osteoarthritis, so when I did surgery, they said you will recover in 2 days, you'll go back home, nothing, no problem. But it's now 1 month. Initially, they said it is because of infection. We will give you some antibiotics, you will recover. I have taken antibiotics now, 2 courses, 3 courses, 4 courses. But in spite of the antibiotics, I get fever every day. Every single day, I get fever. Huh? And I don't know what to do. And my fever also is, not very high. I have fever around 100 or 100.2 Fahrenheit. That's all. That much fever only I have. I don't have more fever than this. Okay. So here again, what can you do? Can anyone suggest? Where will you look for characteristic symptom? How to approach this case? Hmm? Anybody in the chat? Hmm? Generally, we can think like this. We can say that ailments from operation, maybe staphysagria, ailments from operation, maybe um, arnica, maybe bellispur, maybe symphytum, things like that. We can keep thinking. No, but what I want to tell you is, as I said in the last case, focus on chronology. Focus on chronology. Ask the patient, ask the patient, where did the complaint begin? It began with operation. Okay, no problem. Hmm? It began with operation, fever. So, what happened after the operation? What was the first symptom? How did this all begin? You know, one of you have written, should we ask complaints of osteoarthritis? See, we can ask, and we actually, if it is a chronic case, I will ask about the symptoms of osteoarthritis, and I will see the other symptoms in other areas, and then I will find a pattern between the osteoarthritis and the other complaint, and then I will reach a remedy. But in this case, I am treating the acute, and this, whatever main concerning, most bothering complaint for the patient at present is fever. And the fever's chronology has started only 1 month back. It is not before osteoarthritis. It was never there before this operation. So whatever has happened during the operation. So that's why I'm starting from there. So now what you have to ask is, you have to ask, what was the first symptom? What is the first symptom you developed after this operation? So she said the first symptom I developed was redness and congestion. And whatever you see, no, this redness, burning, heat, this is what I developed. So this should tell you that actually there is congestion, inflammation in the knee joint. And staphysagria is actually a nerve remedy. And because it's a nerve remedy, you will have pains like shooting, darting, pricking, radiating, those kinds of pain. This patient is not having those kinds of pain. That tells you you don't need a nerve remedy. Instead, you need a inflammatory remedy, because all these symptoms are symptoms of inflammation. So whatever I do, the first symptom that I know is inflammation. Inflammation of knee joint. This is my actual first symptom, because I have established the pathology is inflammation. It is not operation. It is what happens because of the operation. Because of the operation, if I develop shooting, darting pains, then I know it is nerves. Because of the operation, if I develop bluish back discoloration, then I know it is vein affinity and there is internal bleeding. Then I will think of arnica. Because of operation, if I have septicemia, then I will think of bellispur. Because of operation, she is having inflammation. This is some other remedy. This is not arnica staphysagria. Patient is having inflammation. So you have to think, there is an inflammation. Which remedy has inflammation? Then what you ask is, okay, after all these symptoms, what is the next symptom you develop? That is why you ask, I said chronology. First, then you ask second symptom. What is the third symptom? Then fourth symptom. The next symptom, she says, is I developed fever. I said, what do you mean? How does your fever begin? So she says, actually, the fever begins with chill. I said, how does the chill begin? She says, the chill begins in the toes. Every time, what happens is I start sensing something is cold in my toes. And the moment I feel that coldness in the toes, I know that I am going to develop fever and I will develop fever. Okay, so then I knew this is characteristic symptoms. So what I did is I went to the repertory. And I said, first, I have to treat the pathology. Pathology, according to BORGES' understanding, is there is inflammation.
Sir, we have 4 minutes. It will finish, right?
Yes. We have inflammation, knee joint. You see, I take this first symptom, inflammation, knee joint. Then what I take is chill, beginning, limbs, and toes. See, toes. Chills beginning in toes. And if you see the repertory sheet now, there are two remedies that are coming up, bryonia and sulfur. Now I will ask the patient, what is his physical general symptoms? If the patient says, my thirst is increased, then I will think of bryonia. If he says, I have heat, I have burning, I have hot feeling, etc., then I will think of sulfur. If he does not say that also, then I will say, is the patient anemic? How is your anemia? What is your blood report like? Then I will think of ferrum metallicum. If the patient if says no to this also, then I will see whether there are symptoms of sepia. How is your menstruation? Are you undergoing menopause? What are the complaints during menstruation? Like that, I will differentiate now. But this patient got the remedy sulfur because her main feeling was burning, heat, redness, etc. So based on this, I gave her sulfur, after which the inflammation and the fever reduced and the swelling reduced. So that is what we have to see, that we have to see what are we treating, what is behind these symptoms. We don't just, what is happening to us is we are just looking at, operation, but give some operation remedy. No, operation causing what? What is the effect? What kind of pathology? That is Boger. Boger is saying, look at the pathology and treat that. If you do like this and then you find characteristic, your result will be 100%. Boger had 99% of 90% result, he said, I have in typhoid cases. Why? Because he knew exactly what to treat. He didn't treat only symptoms. He treated what is behind the symptom. What is the pathology behind that? If you treat, you'll have great success. And I hope I have inspired all of you with this.
Really inspired. Because while sitting here, it is exactly different from other webinar that your class, the style of your class taking class is like a teacher explains the things in the classroom, no? Like teacher student.
Yeah, you're muted. I can't hear you. Hello. Yes.
Hello.
Now I can hear you.
It is same like classroom experience. Really, I experienced like that. The participants, you have no time to ask any question and give your appreciation. Only 1 minute. You can text the message in the chat box. That will be nice, because I don't know, because we cannot.
So you like the teaching approach, or you want just a presentation?
Really like the teaching approach, and even you inspired actually those who are not using the Boger repertory will go to go and search, because the way you teaching is completely directing to that way. I think you also experienced the same, right? Dr. Hariharan and Dr. Ram Parvesh Shah both raised hand, but it is the time for the Malayalam session. It's already 7:30. I'm so sorry to you. Please type your message. Doctor will see and reply for your message. Okay. Dr. Mariamma John, now I'm inviting you to moderate Malayalam session. And thank you so much, sir. And love your presentation. Come again and teach us. Thank you so much. Bye-bye on behalf of IFPH, and welcome Dr. Mariamma John for moderating Malayalam session. Thank you.